The park, like I said, was just overwhelmed. No children would play. I didn't see a child of first when I first came here. I thought, I can't believe we have a park and there's no children. And I kept looking and I realized no parent was going to bring their child in the park when you got people that were so intoxicated laying all over, doing all kinds of things from urinating to defecating in the park, in the open.
We were walking one time over between 11th and on 11th between MLK and J Street, and behind this one building there were 35 Old English 40-ounce empty bottles.
In fact, I distinctly remember the testimony at the city council. One of these kids gets up there and says, you know, when the kids in the other neighborhoods go home from school, they play and they go out with their friends and play. When we come home from school, we have litter posse. We pick up the drunks' bottles. That was pretty powerful. And that pretty much describes what it was like.
And I was constantly going out and having to contact chronic public drinkers or call the fire department to come because somebody was passed out on the grass. Well, what happens is we get a man down call. There's an intoxicated person who has consumed so much alcohol that they're now basically incapacitated. The police respond to it, determine that there's no crime been committed. We then call the fire department. Engine company responds. They're the first responder. They assess the situation. If the person's incapacitated, then they call the paramedics. Paramedics come, give a further evaluation, contact the hospital, then an ambulance comes, and then they're transported to the emergency room. So there's multiple layers of service, but it starts out with somebody in a police car going out and answering a call. They end up in the emergency room. Then the emergency room staff has to do their assessment. Okay, no medical conditions. The guy's intoxicated. Now he sobers up in the emergency room. You have a limited amount of beds in an emergency room. They now have taken up a bed. That means they're going to be there from anywhere to 4 to 8 hours sobering. That bed is now consumed by that person for that period of time and can't be used by anybody else. A lot of those people are indigent, they're transients, homeless. They do not have services. So on the hospital end, those are no pays. You know who pays for that? You and me, who have insurance. So our insurance providers, through our co-pays, we pay for it. So as consumers, we end up paying for it. The hospital ER docs don't get paid. The hospital doesn't get paid. And so it really becomes very cost prohibitive to operate in this type of system.
We determined that we needed some level of policy to give our police department more authority to take care of the issue. And that's when the city council got involved, when we realized that we needed to address this from a public policy perspective. And in looking and in discussions with our police department and our community liaison officers, they gave us the tool. They mentioned to us about the tool of having an alcohol impact area, which would prohibit sales of these types of products in the areas that we're most concerned about. And so I think it came from their suggestion that we look at this as a policy issue. It had not been done in our state, and so we had to then ratify, kind of rally around the cause and get a lot of different elected bodies involved in it. But that's where it started. Was a concept of let's use public policy to drive enforcement of this issue.
One of the ideas that was thrown out was identifying products that were consumed by chronic public drinkers, and then how we could restrict those products for sale within specific geographical areas where those chronic public drinkers were located within urban areas. And so that was one of the ideas that was thrown out. There were some other things that came out of those work groups, but we specifically then were tasked with working on what were called alcohol impact areas. That was a name that we came up for. So we continued to meet. Of course, nobody's done this before, and so we did some research. There was a couple health departments, King County Health Department did some studies surrounding chronic public drinking. So we gathered some data and saw that we could have an effect on chronic public drinking by the restriction of high alcohol content, low cost products, because that's what chronic public drinkers were consuming.
When you talk about changing systems, changing public policy and influencing public policy, you have to provide good information, good evidence of why. And in the initial work that was done, the fire department, public health, and police and emergency rooms did extensive background work looking at the impact of this population, creating visual maps of where pickups occur, how often they occur, and then linking them to a cost that's associated with that. And very quickly, you start creating a very strong body of evidence to support a change in public policy here.
We had a community group that would come down to the council meeting and do a sweep the night before in their neighborhood on their block watch and bring down to the city council chambers all the empty bottles and paraphernalia associated with this kind of activity just from a one-night sweep of their area. And it was very visual to us on the city council when you see all the remnants of all the drinking that's going on. And again, all being very targeted product, malt liquors and fortified wines that are really geared towards very specific clientele by the liquor industry.
What we started to work on was how can we petition the Washington State Liquor Control Board to allow us to have a portion of our city where the high alcohol content stuff could not be sold, because you can get a 40-ouncer that's high alcohol content for less money than it costs to buy a quart of milk. I mean, it's nuts.
And so we had to actually then formulate policy. Law was developed to allow local jurisdictions to be able to do that. And so we made changes in the Washington Administrative Code that allowed local jurisdictions to have the ability to form alcohol impact areas, to restrict products, hours of operation, review of licenses.
As the manager of the business district, I felt that it was important for me to be part of an effort to appeal to the city with the help and the partnering of the police department to put an alcohol impact area in place here. And it took a lot of convincing because, you're talking about affecting some people's businesses.
And what we found in this is that to do something like this successfully, you need to establish a strong partnership that includes leadership from the neighborhood, from police and law enforcement, from health providers, from business interests, and from your elected officials. And they really need to come together in a unified manner around this to move forward.
The process is that we defined the boundary area, and then we had a 6-month voluntary compliance period with our voluntary good neighborhood agreements. And we asked retailers to do specific things. Elimination of certain types of products. And so we had to go store by store with a citizen representative and negotiate with 56 off-premise licensees. We got less than 50% compliance in those voluntary good neighborhood agreements. So almost half the people complied. But the other half, and I say it's about 90% of them were the problem children for us, did not comply. And so our voluntary compliance period was not successful. And the law allowed us then to go to a mandatory request for the restriction of identified products. And so as long as we had a link between the product that we'd asked for and the chronic public drinker, then the liquor board would view that.
Well, of course, the first reaction and the first attitude about it on the part of the small business owner, the small storekeeper, is, you guys are going to cost me money. And so, with a lot of persistence, you've got to keep going back. You've got to keep convincing that, or attempting to convince that store owner, that shopkeeper, that you're not going to let that happen. You'll do everything you can. And we have done some marketing for people. We had a store down the street that is in the alcohol impact area. He gave up that beer and wine sale. He pulled his phones from outside his store. And we promised him that we would work with him, that we would partner with him. We printed up flyers telling about the sacrifice that he made, the risk that he was taking. We distributed it around in the apartment buildings and the businesses in the area, and invited them to please stop in and visit the owner of that store. Stop in and thank him for making the potential sacrifice, or at least taking the risk that he's taking, and buy something and go back and visit again. make him the good business that he could be and will be if we get in there and partner with him.
So the tactic that I came up with was a boycott and a picket initially. And I would attend the neighborhood meetings, and at several of the neighborhood meetings I objected this. I said, I'm going to have some signs made up, and I'm going to be in front of the store at 5 o'clock, and I said, I may be there by myself. But if you want this to happen, I would highly recommend that you join me. This is an opportunity, and maybe we can get a groundswell going. And the response was good.
So the stores had an opportunity to do this voluntarily and to make all the business adjustments that they needed to make. And a number of them just chose not to. And when it became clear that they were not going to cooperate, then the next step was to go to the Liquor Control Board.
We heard the argument that these are legal products. They're allowed to be sold in these stores. And, you know, the neighborhood people, the city says, no, you know, we've had enough. Even though they are legal products, they're causing a harm to our community. This is one mechanism that we can stop. If we can stop them from being sold, then we see less harm being done. What I say to the industry is, I say, shame on you. You know what? You specifically make those products high alcohol content, low cost, and you target a specific population. Shame on you.
We had to, I think, let the industry know and the Liquor Control Board know that we're very serious about this, and either they can come along with us and join us, or we will take whatever legal action that we could to protect our citizens.
We're an operation with no budget going after these huge corporations that have billions of dollars. Alcohol industry is huge. But I think it's personal perseverance on every single individual that's involved in the process. And it's a level of commitment that, you know what, even though you are the giant, we are going to take you down because you are wrong. And so that's kind of how we operated, was that we really don't care. We know what our goal is. And so we stayed focused on the goal. Even though the industry would try and throw roadblocks up during the process, we always would stay focused on what we wanted to reach at the end of the road.
I think that to the credit of the Liquor Control Board, when they came to our hearings and they, one, saw how unified the public policymakers were on this issue, two, saw how committed the community was on this issue, I think they started getting a real clear sense that this was something that we needed to do.
The next step in this process has been the creation of a pilot sobering program. And a sobering program is a safe place, with staff for people who are chronically intoxicated to sleep off their intoxication, not use an emergency room to do this, not use police or fire services or the jail, and at the same time be in an environment where they can be linked with recovery and treatment services. And it may not be the 5th time, it may not be the 15th time, but maybe that 20th time is the time that they say, I'm ready to get in treatment. I'm ready to make a change. And that's what we've seen with sobering centers, is that they provide that link for treatment that's so important. Not only saving the community money, but linking that population with services.
The best advice I would give another community is, one, is to know that it works. You know, we did all of our data, and we tracked it very closely. And what was most satisfying to all of us who worked on this is, first and foremost, is it had an impact. It had a positive impact in the community. So the first thing you need to recognize is that if you do this, it's going to work, and you're going to see a demonstrative improvement in your community.
The outcomes for us were positive. You know, we saw reductions in our calls for service. Our fire department saw reductions in alcohol-related incidents. For us on the street, that means that there's fewer calls. We then free up time to be able to deliver services to people in our community who need those services, sometimes in an immediate nature.
The last person and the toughest person, I just, about a month ago, I had a discussion with him, and he said he would not go back. And of course, you almost feel like saying, I told you so. But, you know, it's the fact is there, and he sees it. And he smiles and says, I wouldn't go back. It's working. I'm seeing good customers coming in the place of these people that we didn't want here. The people coming in and buying a product that I'm glad I'm not selling anymore.
Nobody's going to do it for you. You've got to do your own work. You need to educate yourself about what you can do. and then you need to get busy and do it. Work with your police department, work with your city folks, work with your neighbors. Nothing can stop a determined group of people who want to make their neighborhood better, and you just need to be part of the determined group.
Take a look. Even though it's raining, you see that there's a parent and some children in the park. Even just walking through the park on a great day, a sunny day, or a nice warm day, the basketball court is full. You see people laying out. We have concert, the Music and Mural Festival. So that it's just like night and day. Somebody switched the light on, and now everyone says, let's go out and have fun in what belongs to us.